Hello everyone, welcome to Logic Medico. Today's interesting topic is phonosurgery. Phono refers to voice. Any surgery designed primarily for the improvement of the voice or for the restoration of the normal voice, it's called as phonosurgery. The first phonosurgery was done in late 1950s by Hans von Leyden. Moving on to the types of phonosurgery. Basically 5 types of phonosurgery. Microlaryngoscopic surgery. In this surgery, a microscopic vision of the laryngeal mucosa, that is interior of the larynx, is got. If at all there is a papilloma, a vocal nodule, some mucosal outgrowth, those particular things can be excised or removed by microlaryngoscopic surgery. Basically it is an endoscope which is attached with a surgical kit. Vocal fold injection is a procedure in which the vocal folds can either be tensed or it can be relaxed, or it can be abducted or adducted based on the requirements by injecting a foam or a collagenous tissue, collagen-like tissue. So that is vocal fold injection. Laryngeal framework surgery is a procedure done for patients who meet with road traffic accidents or trauma of the larynx, wherein there is a reconstruction of the laryngeal skeleton, especially the thyroid and cricoid cartilage. Nerve grafting is a special procedure in which the nerve which is being dead will be grafted with the nerve which is still functional, especially the ansa cervicalis of the neck. It's a loop of nerve by cervical plexus will be grafted into the recurrent laryngeal nerve, which is a paralyzed nerve which is supplying the larynx. Neuromuscular surgeries are surgery in which the muscle along with the nerve is grafted onto the larynx, thereby improving the quality of voice. So these are the 5 types of phonosurgeries. The most detailed one is a vocal cord injection. Indication for this surgery is, that is why we do this surgery, for a temporary correction in cases of unilateral vocal cord palsy, when the prognosis of the recovery is uncertain, for the immediate improvement of the voice required in some patients like singers, they want to sing tomorrow only, so we inject the vocal cord. Permanent correction of glottic insufficiency in certain individuals, and vocal fold atrophy, either due to degeneration or due to connective tissue disease. If the vocal folds are not having any strength, in that we have to instill strength by injecting a material into the vocal cord. Adjuvant augmentation after surgery, that is prior to, because of the previous surgery, either supraglottic carcinoma or pharyngeal carcinoma, the vocal cords are got damaged or weakened, so it can be strengthened by vocal cord injection on trial basis for the in case of absence of arytenoid fixation, in order to fix the arytenoid. The injectable agents are, the temporary injectable substances are the gel foam. It's most commonly used material, but effects last for only 4 to 6 weeks, or it is a major disadvantage, wherein every month they have to get this injection. Next is carboxymethyl cellulose. Actually it is an FDA approved drug or a foam agent which can be injected into the vocal folds. Effects last for around 2 to 3 months. Again, that is a disadvantage. Bovine collagen, the collagen obtained from lower animals like the cow, buffalo, pig. It has a long track record. The length of action will be 3 to 4 months. But the problem is allergic reaction will be there because it is not a human origin. There is an allergic reaction or hypersensitivity reaction. Last but not the least, the human derived collagen. The effect lasts for nearly 5 months and no allergy because it's a human derived collagen. The collagen will give strength to the vocal cord. So these are the injectable material for vocal cord infusion. Next, moving on to the classification of the types of phonosurgeries. The first one is approximation laryngoscopy. As the name suggests, the vocal cord will be approximated towards one another. When is it done? Whenever the vocal cords are abducted. So the procedures include the medialization thyroplasty, the rotation technique, adduction of the arytenoids, and the fixation technique. These are the 4 types of approximation laryngoplasty. Moving on to the expansion laryngoplasty, as the name suggests, we are expanding the vocal cords. We are actually abducting the vocal cord. So when is it done? Whenever the vocal cords are adducted. The types are lateralization thyroplasty, wherein the vocal cords can be approached by lateral side or medial side. Then midline lateralization thyroplasty, vocal fold abduction. Then we use sutural technique. Sutures will pull the vocal cords and keep it aside. Then resection technique. If at all the vocal cords are really large, some portion of the vocal cord will be cut off, and then the remaining portion will be pulled and stitched, like thyroarytenoid myectomy. Next, moving on to the next type of thyroplasty is relaxation laryngoplasty. So whenever you want to relax the vocal cord, so whenever the vocal cord is tensed, right? Yeah. So that is called shortening thyroplasty. You can approach the thyroid cartilage either by lateral approach or medial approach. Next procedure is tensioning laryngoplasty. So when do you want to tension the vocal cord? So whenever the patient has got a loose vocal cord or a lax vocal cord, that time we will do tensioning laryngoplasty. The best example for that is cricoid approximation. Other variety includes elongation thyroplasty, either by lateral approach or medial approach. So these are the 4 basic types: approximation laryngoplasty, or you can call medialization procedure; expansion laryngoplasty, or you can call lateralization procedure; relaxation laryngoplasty, you can tell that as weakening procedure. You are weakening the vocal cord over there, or relaxing the vocal cord. And here tensioning laryngoplasty, you are actually tensing the vocal cord. Laryngeal reinnervation surgery as the most common technique. Once these previous thyroplasties fail, we are going to reinnervate the larynx, which has been either recurrent laryngeal nerve palsy or external laryngeal nerve palsy, with the either the muscle with the nerve, it's called neuromuscular pedicle, or with only the nerve. I already told you in the beginning, the nerve is a loop of nerves, C1, C2, C3 fibers of the cervical plexus. It's called ansa cervicalis. It is being joined with recurrent laryngeal nerve. So RLN means recurrent laryngeal nerve anastomosis. It's like some pipe has been damaged, you are replacing it with a new pipe. This pipe, what I told now, is a nerve fiber. Ansa cervicalis is now joined with recurrent laryngeal nerve. So that is called a reinnervation surgeries, wherein the surgery is done so that the larynx without nerve supply is now controlled by a new nerve, that is ansa cervicalis. In summary, the type of phonosurgeries include phonosurgery. Phono refers to voice. If you want to restore the normal voice, or if you want to improve the quality of voice, they will do phonosurgeries. There are 5 types of phonosurgery. Microlaryngoscopic surgery. For the mucosal surface, usually we do the surgery. For the vocal cord, either we will do medialization, lateralization, tensioning, or relaxation. It's called vocal fold infusion, either by gel foam or with cellulose or with the collagen. It can be bovine collagen or human collagen. Laryngeal framework surgery is a special procedure done to reconstruct the fractured epiglottis, thyroid, or cricoid cartilages. Nerve grafting is ansa cervicalis grafted with recurrent laryngeal nerve anastomosis. Neuromuscular surgery is neuromuscular pedicle. In the neighboring area, infrahyoid muscles are replaced onto the laryngeal muscles to strengthen the laryngeal muscles. Thank you for watching and learning from Logic Medico. If you are new to the channel, kindly consider subscribing. Don't forget to press the thumbs up icon showing that you like this video. Share this video with your friends. Thank you.